of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about the proper procedures on how to administer an intramuscular injection. But first, let us talk about what is intramuscular injection. This is deposit medications into the muscle fascia, which has a rich blood supply, allowing medications to be absorbed faster through muscle fibers than they are through the subcutaneous route. The item site or the intramuscular site is used for medication that require a quick absorption rate but also a reasonably prolonged action, used for antibiotics, vaccination, and immunizations. Common sites are ventrogluteal, vasos lateralis, and the deltoid muscle. In here, I will be using a Z-track method to administer the medicine. So, what is Z-track method? Z-track method or technique is a method of administering an IM injection or the intramuscular injection that prevents the medication being trapped through the subcutaneous tissue, sealing the medication in the muscle and minimizing irritation from the medication. And now, let us talk about the purpose of administering intramuscular injection. First, it offers a faster rate of absorption than the subcutaneous route. And lastly, muscle tissue can often hold a larger volume of fluid without discomfort to the patient.
At first, you must need to prepare the medication or solution.
Preparing medications ensures patient safety with medication administration.
And yes, don't forget to perform a hand hygiene. But wait, you must also need to gather your supplies.
To prevent the spread of infection and organization facilitates accurate skill performance. Good day, ma'am. Your name, please? Good day, Ma'am Irene. And I am Maria, your nurse for today. So, I will be administering you via intramuscular injection in order to have a faster rate of absorption rather than the subcutaneous injection. So, just simply relax and please cooperate. And if you have any questions, don't hesitate to ask me. Thank you. Explaining rationale increases the patient's knowledge and reduces their anxiety.
And then close the door, as well as the curtain for your patient's privacy.
This provides patient privacy.
And then compare MAR to patient wristband and verify if this is the correct patient using two identifiers.
accuracy of the medication or solution and prevents errors.
And then, assess your patient for any contraindications for the medication.
Assessment is a prerequisite to the administration of medications.
And yes, don't forget to don disposable gloves.
Gloves help prevent exposure to contaminants.
Select appropriate site for administration and assist the patient to the appropriate position as required.
Site should be free from lesions, rashes, and moles. Choosing the correct site allows for accurate reading of the test site at the appropriate time.
And then, clean the site with an alcohol swab or antiseptic swab. Use a firm circular motion and allow the site to dry.
Pathogens from the skin can be forced into the tissues by the needle. Allowing the skin to dry prevents introducing alcohol into the tissue, which can be irritating and uncomfortable.
Next, remove the needle cap by pulling it straight off the needle.
This prevents needle from touching side of the cup, prevents contamination, and reduces risk of accidental needle stick injury.
And then, displace skin in a zigzag manner by pulling the skin down or to one side about 2 cm with your non-dominant hand.
The Z-trap method creates a zigzag path to prevent medication from leaking into the subcutaneous tissue.
And then, quickly insert needle as if holding a dart at a 90-degree angle. And then, move your dominant hand to end of plunger.
A quick injection is less painful. Inject medication at approximately 10 seconds per ml because the injection sites recommended for immunizations do not contain large blood vessels. Aspiration is not necessary when giving vaccines.
Once the medication is given, leave the needle in place for 10 seconds. And yes, avoid moving the syringe, okay?
Leaving the needle in place allows the medication to be displaced into the tissues. Movement of the needle can cause additional discomfort for the patient.
Once the medication is completely injected, remove the needle using a smooth, steady motion. And yes, engage the needle safety system immediately.
Using a smooth motion prevents any unnecessary pain to the patient. Engaging the safety system helps to reduce risk of needle poke and exposure to BVF. Do not massage to the site after an IM injection or the intramuscular injection because it can cause damage to the underlying tissue.
Using a sterile gauze, apply gentle pressure at the site after the needle is withdrawn and do not massage the site.
Massage is not necessary and can damage underlying tissue. Massaging after a heparin injection can contribute to a formation of a hematoma.
And then discard syringe and needle into appropriate receptacle.
Safety shields and needle guards help prevent accidental needle stick injury.
And next, dispose some of your supplies to use and remove your gloves. And yes, don't forget to perform a hand hygiene.
This reduces the risk of infection and the spread of microorganisms.
And next, document the procedure and findings according to agency policy.
Timely documentation ensures patient safety.
And also, evaluate your patient response to medication.
For it is important to evaluate the therapeutic effect of the medication and assess for the adverse effects. And that ends my written demonstration about the proper administering of intramuscular injection. I hope you learned something new from me today. I hope to see you next time in my another written demonstration. Once again, this is Aliyah P. Ayaras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you for watching!